So what if I told you that you could get a full health screening, not at some clinic, but right from your couch using your phone, and all in the time it takes to make a cup of coffee? Well, that's exactly the tech we're going to break down right now.
I mean, just let that sink in for a second. An entire afternoon of tests and waiting rooms, all of that, just crunched down into a single minute on your phone. And, the reason I sound so sure about it is, well, I actually did one this morning.
All right, so let's get into it. First, we're going to cover what this 60-second check really is. Then we'll peek under the hood to see how it all works. And, most importantly, we're going to talk about why any of this actually matters for you and your health.
Okay, before we go any further, we have to get something crystal clear. On the left, this is what we're talking about. It's a screening. It helps you create a baseline for your health. And maybe it gives you a little push to act if something seems off. But, just as important, look at what this is not. This is not a diagnosis. It is definitely not medical advice, and it is absolutely 100% not a replacement for your doctor. Think of it as a new tool, not the whole toolbox.
So what is actually going on during that 60-second scan? I mean, how on earth can your phone's camera and microphone pull any real health info just by looking at you? Come on, let's pop the hood and see what's happening.
The whole process is just ridiculously simple. You open the app, you give it the usual permissions for your camera and mic. Then, you just stare at your phone's camera for about 30 seconds, you read a quick paragraph out loud, and boom, that's it. Your report is ready. 4 steps, and you're done in under a minute.
And this is the really cool part. This is what the AI is actually picking up on. It's looking for these tiny, almost invisible changes. For heart rate, it's not listening for a heartbeat. It's watching for super subtle shifts in your skin tone that show blood flow. For stress, it's catching micro-expressions you don't even know you're making. And when you talk, it's listening to the acoustic patterns in your voice to check your respiratory clarity. It's honestly mind-blowing stuff.
So, okay, the tech is pretty slick, but so what? Why does it matter? Well, the real value here is that it helps solve a problem that, let's be honest, pretty much all of us have faced.
20 minutes. That's it. That's the average amount of time a person over 50 actually gets observed by their doctor in an entire year. At 20 minutes. Everything that happens for the other 364 days, it's basically a total black box.
And that is the gap these little screenings are meant to fill. See, if you do them a few times a week, you start to build your own personal baseline. You learn what's normal for you. And that gives you the power to answer that one nagging question we all hate. Do I feel bad enough to actually call the doctor?
Let me tell you a quick story about this. A friend of the author had been using one of these apps for a few months, so she knew her baseline really well. And then, one day, the results looked different.
Her report flagged 3 specific things. Her resting heart rate was higher than normal, her respiratory clarity was lower, and her stress markers were up. Now, you could probably explain away any one of these on its own, but all 3 together, that painted a pretty clear picture that something was up.
And here's the key part. That screening gave her the little nudge she needed to actually make the call. She went to her doctor, and sure enough, she was diagnosed with early-stage bronchitis. She caught it just in time before it turned into something much worse. The app didn't diagnose her, it just gave her the confidence to get professional help right when she needed it.
Now, of course, with any powerful new tool, you've got to know the rules of the road. So let's talk about how to use this kind of technology safely and, smartly.
There are 3 really, really important things to remember. Number 1, and this is non-negotiable. If you're in a real emergency, call a doctor, period. Don't mess around with an app. 2, don't freak out over one weird reading. It's just one piece of data, not a final judgment. What you're looking for are trends over a few days. And 3rd, be smart about your data. This is your health info, so make sure you pick an app with a really clear and strong privacy policy.
Okay, so let's zoom out for a minute because this isn't really just about one cool app. This is part of a much bigger change in how we even think about healthcare.
There's this idea called ambient medicine. And the thinking is that healthcare isn't just a thing that happens inside a clinic anymore. It's becoming part of our environment. It's on our phones, on our wrists, in our homes. This ambient layer isn't here to replace the clinic. It's here to get us ready for the clinic. It helps us know when it's really time to go.
For most of human history, we only really got a good look at our health when something was already wrong. But now, we have the power to see a daily signal of how we're doing, and that constant stream of information, that's the real change here. The only real question left is whether we're ready to accept it.
So if you're even a little bit curious, honestly, the best way to understand this is to just try it.
The author mentioned an app called Bina.ai as a good place to start. So maybe download that or find another one like it. Do a scan today, do another one tomorrow, and just see what you learn. It might be the start of a really powerful new habit. Thanks for hanging out with me.